Welcome, welcome. My name is India Klipfel, and I'm the Director of Admissions here at St. Catherine University. And welcome to our virtual event to learn more about our nursing program. We're so excited to have you. We're really excited that you have been accepted into our amazing community with a goal to educate women to lead and influence. So as we hear tonight from our nursing faculty and our nursing students, please feel free to use the Q&A box at the bottom to put any questions in the chat, and I'll be watching that. With that, I would like to introduce Dr. Jessica Meehee. She is one of our professors in the nursing department.
Great, thank you, India. Nice to see everybody here. I first just wanted to make an introduction of one of our current nursing students, Baobei Zhang, excuse me. I don't know, do you want to just take a second to introduce yourself?
Yeah, of course. Hi,
Okay.
everyone. My name is Baobei Zhang, and I'm a fourth-year nursing student at St. Kate's. Introduction about myself. I just finished my preceptorship, so that's during your senior year. You have to complete a total hours of 135. So fortunately, I finished with that, and I'm just getting ready for the NCLEX in graduation.
So exciting. Thank you so much. I'll start going through the presentation, and then Baobei, if you have any additions, feel free to jump in, and you can answer questions at the end too. So I'm going to go ahead and share my screen. All right, did that pop up for everyone? The presentation?
Yes, it did.
Great.
Okay, great. All right. So welcome. So like India said, this presentation is specifically about the College for Women Bachelor of Science in Nursing program. This is a photo of our current group of senior students. We a couple weeks ago went down to the Capitol in St. Paul and met with some legislators and had a tour, and we met with, you can see the Representative Tina Liebling here in the middle of the picture, and she said something I thought was really powerful to our students, that there's power in this room. St. Kate's really prepares future nurses to lead and influence, and I think she was a great example to what our future nurses are going to do. Currently, we have just over 250 students enrolled in our programs. So you have there's the breakdown there of our seniors, juniors, and sophomores. Students will talk a little bit more about the admission, but you start in the program as a sophomore, or in your second, I guess, semester of sophomore level. Depending on the semester, we have sometimes up to 35 nurse faculty. We have about 12 to 13 full-time faculty in the program, and then we use adjunct faculty to help teach clinical. All of our faculty are very current in practice. Many of them are still practicing at the bedside. They participate in nursing service in the community and different types of research practice. Something kind of unique to us is that you may have been in touch already with academic advising through the university that helps guide you through which classes you need to take in the nursing program, but you're also paired with a specific nursing faculty that will stay with you throughout the program, which is a really kind of nice option and a great way to get to know your faculty personally. We also have one faculty in our program who serves specifically as a student liaison. Her name's Beth, and she wasn't able to be here tonight, but she is another support and resource for students directly in the nursing program. And very soon, we're starting a new Student Achievement Center specifically for nursing and School of Health students. We've noticed that and know that our health students have different needs and requirements because of the professions they're going into. So the university offers many resources and committees and departments to help students through the university, but we've decided that we really want to help support students within the nursing program. So probably by the time you are starting at St. Kate's or within the nursing program, our Achievement Center will be up and running fully. Our nursing program is accredited by ASIN and approved by the Minnesota Board of Nursing. Additionally, we are endorsed by the American Holistic Nursing Credentialing Corporation. There's actually only 17 colleges nationwide that have this holistic endorsement. So after you graduate, you are eligible to sit for the holistic test if you wanted to get certification, and that looks really great on your resume. Additionally, after you graduate, you're eligible for a public health certification as well. So by the time you graduate, you'll be ready to take the NCLEX, which is the licensure exam to become a nurse, get that public health certification, and be a holistic nurse as well. And even if you decide not to get those certifications, you'll have had the education throughout your years in the program. I did put a link in here to our website that shows where the prerequisites and major requirements are. And I think I have a slide maybe coming up too, but I'd encourage you to take a peek at that. We are in the process of revising our curriculum, which will start in spring of 2025. And when that happens, students have the opportunity to actually complete all of their prerequisites before they're admitted into the program, which is really great because you'll get to just focus on nursing courses. You will apply to the nursing program the fall semester of your sophomore year. All applications are due every year, October 15th. And then the nursing program starts right away, spring semester of your sophomore year. And you'll jump right into classes and clinical and lab and simulation. We do have the option of first-year students who start at St. Kate's to get guaranteed admission. So if you meet all the admission requirements and have a GPA of 3.25 or higher, and then a TEAS test result of proficient or higher, you're guaranteed admission into the program. So these are the prerequisite courses. I won't go into detail on those, but just know that they're here for you if you're interested in looking at those. So some of the other application requirements, you have to have a minimum of a C in all those other prereq courses. You can't have a satisfactory or unsatisfactory in those courses. It has to be a letter grade. You must have a current certification for a certified nursing assistant in the state of Minnesota. Once you get that, you don't need to renew it or keep up to date with that. We just require students to have that on admission. If you have your nursing assistant certification in another state, there's typically an option to get that transferred to the state of Minnesota, and it does take a little bit of time, so I'd suggest doing that as soon as possible. All students must also have the basic life support or CPR certification for healthcare providers, and that is something that you need to keep up to date throughout your time in the program, and that is current usually for 2 years. And then the other requirement is you must be up to date on all of your immunizations to meet the School of Nursing requirements, and we'll be giving you more information about that as well. So here is the new plan of study that will start in spring of 2025. You can see you'll start again in spring right away, your sophomore level, we call it level 1 or sophomore year, starting in a foundations course that has classroom, clinical sim, lab, and then also a holistic nursing practice. You'll go through pathophysiology and pharm, take acute care, med-surg, population and global health, which is similar to a community health type course, behavioral health and mental health. And then senior level, you start getting into the pediatric care and labor and delivery, holistic leadership, and prepare for the nursing practice. So oftentimes you may have heard of this too. Once our students graduate, they're known as Katie nurses out in the community. They're very, very well known and highly sought after in the community and from health systems. And I wanted to just kind of provide some definition to that and what that means. So the KD nurses prepared to really look at evidence-based holistic nursing and prepared in the skills they need to be successful in many different areas of nursing. The KD nurse embraces multicultural and social justice perspectives and serves the community and promotes health equity. Our nurses, our leaders tend to be leaders in nursing and change agents, and often have great job opportunities and placements. Many of our seniors from this year and in the past often have job placements or offers before they even graduate. Go ahead, Balbe.
Yeah, and I'd also like to add that even during your clinicals, as a KD nurse, I think we really stand out. I remembered going to Abbott Northwestern this fall, and when we said that they saw our logo, St. Catherine University, and right away they're like, "Oh my God, KD nurses, we love you guys. You guys come on the floor, you guys know what to do." So St. Kitts definitely prepares you enough, very well recognized by other facilities, and they're also really happy to have us.
Yeah. Thank you. That's a great comment. And I'm going to actually skip ahead to this clinical partnership. We reached out to some of our partners to get feedback on our nursing students. So Baobai's explanation of one of the Alina clinical sites we're at, they were one of the people who got back to us. But some of these sites really say that our St. Kate's nursing students stand out, sets them out from their peers based on what they do. They get into leadership positions quickly, mentors on their units. So you're very well prepared as a nurse. We have many partnerships within the community to help our nursing students. So the ISAIL, the Institute of Simulation and Interprofessional Learning, is actually something within St. Kate's, but we have a pretty robust simulation center. So all of our students starting their sophomore year get to participate in simulation, which means they're in a setting in the lab where they're caring for kind of a fake patient, but in kind of a real life scenario. So it's a very safe place to ask questions, to make mistakes if you need to, and learn from it. This is a photo, actually, this top photo is of nurse faculty from Japan who came to visit our ISAIL center and meet with our faculty too. So we're pretty well known in that area. We're also a partner of the Nurse Climate Challenge. So one of the goals that organization has is to educate nurses and health professionals on the impacts of climate change on patients' health. So we're actively involved with that. And then, as I mentioned, we're endorsed by the American Holistic Nurses Credentialing Corporation. We have many dozens of clinical partner sites in the Twin Cities and across Minnesota. The SMART Clinic is actually located right on at St. Kate's in the same building where you would take classes. So it's an interprofessional clinic, PA students, physician assistant students, nursing students, social work, OT, and I think there's some other students there that care for individuals without insurance. So they're people that are coming in from the community who need some sort of care, whether it's health care or occupational therapy or some sort of guidance on just their health in general. And so you have that's one opportunity that students have to volunteer at that clinic. The Rise Up Health Clinics is just another example of a community organization that runs school-based health centers. So you get to do clinicals and flu vaccine clinics at many different community organizations. This photo of the young people with stethoscopes. Some of our faculty and students went to Hennepin recently to bring mannequins and stethoscopes to students who are interested in going into healthcare. So there's, again, lots of service opportunities at St. Kate's. And then this is a list of many of the healthcare organizations that we partner with and go to clinical. These are just some of our Katie nurses who have since graduated or are currently in our program. We have this. I felt actually kind of guilty about only putting 6 people up there because so many of our grads have done such wonderful things. But I think this just is such a great representation of all the things our nurses do and the impact and change they're making out in the community. There's many nursing student opportunities and activities on campus. So officially, we have several nursing associations, the Student Nurse Association, the Nurses of Color, and just newly formed was the Black Student Nurse Association. So you have the option to join those organizations if you want to. It's a great group of students doing great things. Students can also represent their cohorts or their classes on various committees. So our faculty are on committees for students that talk about student processes and student success, and also a committee on curriculum where we're discussing the courses and the program itself. So we ask for student representatives from every class to, sometimes they poll their classmates and say what's going well, what's not going well, what would you like me to bring back to these committees? So it's a great leadership opportunity. We have something called Nurse Katie's Closet, where students, not only from nursing, but other healthcare professions who might have some barriers to purchasing the uniforms or scrubs they have to wear to clinical. Previous students will donate those scrubs. You'll see in some of these photos, we wear the very visible bright purple scrubs. So students can go and get those scrubs free of cost. And then we also use students to help organize those scrubs and be part of that organization. Students have the opportunity to be a mentor later in the program. So if they'd like to help younger cohorts or younger students be mentored on their different courses, there's the option to do that. We have many student athletes. I didn't put this on here, but many students have full-time, part-time jobs or casual jobs. Many students have families. So that is a doable thing if you're in other activities or have other family commitments. And then it looks like the slide cut off a little bit, but we have competitive fellowships and research opportunities that students can be part of as well. This is some data on some of our recent graduates. So you can see that the areas that our grads go into is really wide and so much variety. You're very prepared to be a generalist nurse and go into pretty much any area that you're interested in. And then this is, again, a list of all of the employment areas of hospitals, clinics where students have gone to, and it's not complete. This is just part of that. So in our most recent data, we don't have data yet from our 2023 grads, but from 2022, over 97% of our students, when we sent out a survey, were already employed as a registered nurse. And then I did want to just mention too that I think St. Kate's is really unique in that it has a great pathway program for students. So students can start at St. Kate's as getting their nursing assistant certificate and go all the way through doctorate programs. So after you graduate or once you're in our nursing program, getting your Bachelor of Science in Nursing, there are some pathway programs that allow you to go straight into nurse practitioner school at St. Kate's. We have graduate programs for adult gero, nurse practitioner, family nurse practitioner, pediatrics, neonatal, and mental health. So that is an option. We've had a handful of students do that. Here is some of our contact information. If you have specific nursing questions, you can reach out to our nursing email. If you have questions about admissions or prerequisites, you can reach out to the admissions email address. And then hopefully you can connect with us on some of our social media platforms too. We often post interesting things that are happening in the program and successes of our students. So Paubai, I don't know, do you have anything else to add about your personal experience?
Well, I would say that when I was around your guys' age and also at the time of about to enter college, I've always been really excited to like listen to other students' perspective because that was kind of like my easy way, or not easy way in, but that's kind of like my way of getting in just like a deeper dive of the program. So I'm really happy to answer any questions, but I would say that my time at St. Kate's has been good. Definitely not easy, but I think that's part of it, all of it. But I'm grateful to say that although it wasn't easy, I always supported by the faculties and also by my peers. Um, I know that all of this information can seem very overwhelming, but once you're in it, you are always guided. Like, for example, all of your certificates that Jess was talking about, and also like the BLS, that is provided for you. Like those resources are given to you. Those things are like reminded. It's not like you're thrown into it and you have to figure it out yourself. It's never like that. Um, the way when I'm saying like you feel supported, you really are. You have like a faculty mentor with you. You have all these faculties who do try to reach out and really try to help you do the best. It'll be a lie to say that they set you up for failure, but they don't. They always try to really do what the students are learning and also are there to support your learning and not only that, but also support your personal life. So I would say I'm very happy that I chose this. I remember being a senior in high school, contemplating which one to go to, having all these choices, but St. Kate's, you are recognized everywhere you go and always give it a try.
Thank you.
Thank you so much, both of you, for sharing. There is a question in the chat, and students, feel free to, if you have any other questions, put them in the chat. Can a nursing student graduate in 3 years if they have a lot of college general classes already done from doing PSEO in high school?
It's a really great question. So the nursing program itself is 2.5 years. Um, so beyond that, with your prerequisites, I would recommend working with your academic advisor to see which of those classes will transfer in and be eligible for those prerequisites. So that definitely could be an option. But once you're in the nursing program, it is a set 2.5 years.
Perfect. Thank you. Here's another question. Are there any minors that pair well with a nursing degree?
Mhm. Baubai, do you know of any of your fellow classmates getting minors?
Yeah, I know actually a lot of minors in psychology. I've also heard a really good one with sociology, a minor with sociology as well. Those two seem very doable so far with the people that I've known that have minors in them.
And I have known a few people who I think they've done minor in maybe like public health, um, American Sign Language, Spanish. So yeah, it is possible.
Perfect. Thanks. And we have a question in the chat about showing the prereqs. So Jess, you are on it. Thanks for showing
Yes.
that.
Yep.
Baba, maybe a question for you. What has been your favorite memory over the last few years of being a St. Kate student?
I think my favorite memories have been lab during my nursing courses. You do so much hands-on during labs. The things and the skills that you do, oftentimes they become like muscle memory. At first, when you do it, you're like struggling. Like, for example, you're struggling to even hang an IV bag or struggling to like hold a needle because you're so nervous. But now that you've done it so often, when you're at clinicals, when you're at like your preceptorship, it's like muscle memory. You do it without even thinking about it. But I did also want to talk about like prerequisite courses too, that I think oftentimes maybe prerequisite courses can be really hard, but with these courses that you're taking, it's also very helpful for you in the nursing course as well, especially with anatomy and physiology, psychology that you do. Maybe at the time when you're taking it, you might be questioning, like, why am I taking these courses? They don't talk about nursing at all. But prerequisite courses build up in the nursing program, and these are really helpful courses. So I would say really prioritize and do well on these courses.
Perfect. Thank you. Well, those are the questions that we have. Again, this was recorded and we'll be sharing it out. So for anyone who wants to watch it again, you're more than welcome. But thank you everyone so much for joining and have a wonderful evening.
Thank you.